This episode is brought to you by Indeed. Stop waiting around for the perfect candidate. Instead, use Indeed sponsored jobs to find the right people with the right skills fast. It's a simple way to make sure your listing is the first candidates see. According to Indeed data, sponsored jobs have 4 times more applicants than non-sponsored jobs. So go build your dream team today with Indeed. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Did you know over 50 million Americans live with chronic pain every day?
One of the things that we want to keep in mind is that, your central nervous system, your brain, your spinal cord, and the nerves that come out of the spinal cord are what control everything.
What are maybe 3 simple lifestyle changes that they could start today that may bring some relief to their pain situation?
Exercise is very important.
For a majority of their life or since their accident or illness, I remember one of my biggest worries was that I was going to miss the will of God. Part of my life story since I broke my neck, I knew pain was, and back pain is the #1 cause of disability worldwide. Did you know over 50 million Americans live with chronic pain every day? That's more than diabetes, heart disease, and cancer combined. And back pain is the #1 cause of disability worldwide, keeping more people out of work than any other health condition. And maybe most shocking of all, 1 in 4 patients prescribed an opioid for chronic pain end up struggling with addiction. This is the painful reality for millions of people. But today's guest has spent over 2 decades proving there's another way. Dr. Alex Halario is the founder of Chiropractic Rehabilitation Source in Yonkers, New York, and one of the top-rated chiropractic and acupuncture clinics in Westchester County. With 21 years of experience, Dr. Halario blends science, holistic care, and faith to not just treat the body, but the mind and spirit as well. He's the father of 3, a power lifter, and a man who believes healing is about more than just pain relief. It's about reclaiming purpose. Dr. Alex, thank you for taking some time to come on the SwagAbility Show today.
Thanks for having me, and I appreciate it. Thanks for your time.
Yeah. You've been practicing chiropractic care for, over 21 years, over 2 decades. Was there a turning point or a moment when you realized this was your life's calling? Was there an aha moment that what I'm doing now isn't quite cutting it, and I want to turn to providing care relief for people?
Yeah, so when I was an undergrad, I was pre-med, and I was thinking about going to medical school and becoming a pediatrician. But I was kind of doing some research, looking into different professions, dentists, podiatrists, psychologists, medical doctors, chiropractors, and I really liked what the chiropractor was doing, and the fact that he was able to help so many people with just about no side effects. That was very interesting to me. And just as I was before I was about to move out of my apartment, I was lifting a heavy sofa, and I hurt my back. I herniated a disc and had a pinched nerve, and I was dealing with severe pain. And I reached out to the chiropractor that I was shadowing, and he was able to eliminate my pain and get me going again. And that was pretty amazing to me. So I decided to pursue that career, and I've been able to help a lot of people, and it's made a big difference in
Pain
my
was
life.
what actually shaped your career. If we can think back to uh, the piano, you said it was a piano lifting or sofa lifting. What was life like before chiropractic healing entered your story? What was pre-medical, Alex? Were your ambitions always in the medical field because you wanted to help people, or what did life look like pre-professional, growing a renowned clinic?
Yeah, I mean, I was always interested in the medical field and being a doctor and helping people. I was actually 7 years old when I was like, I'm going to be a doctor. So I was pretty young, and It wasn't about money, it wasn't about status or anything. It was just about helping people. And yeah, things kind of switched up a little bit when I was an undergrad, and I realized, I learned about chiropractic. I had never gone to a chiropractor myself as a patient prior to that. So it was pretty impressive, and it was life changing for me.
Hmm. Uh, when I was researching um, for our time together, it talks a lot about holistic care, and that's something at SwagAbility we wholeheartedly agree with. It's not just about providing a fix with money or an adaptive aid. We believe in addressing the soul. How did faith influence the way you approach both recovery as well as building your practice as it stands today?
I think it's helped me a lot in how we treat people, how we prioritize, how we love others. Also the ability to be able to travel and help people in different countries. I was able to do some mission work as a chiropractor and just bring a portable table and just help tons of people. It's allowed me to give back, and I think that's a big part of my faith, and just the process of being grateful for the opportunity and the gift that I have.
Mm. And I don't want to pry too hard, but is your faith, are you a born again believer or Christian?
Yes,
A faith you espouse to? Yes. Yeah.
yes.
Similar like a Doctors Without Borders thing, or these were similar mission trips and you would be the only doctor on a trip per se?
Um, I was the only doctor in some of those trips
Mm,
where, we also integrated the Christian faith, and we had a pastor come with us and share the word, and we
wow.
had people praying over our patients. So it was very integrated. It wasn't just about, providing care, but about praying over people and sharing the word of God.
Um, Alex, some people think of chiropractors as we see the memes. People breathe in one, two, three, and then their legs go above their head, or often that it's just about cracking bones. What are some of the biggest misconceptions you face about your field?
And it's not really bone on bone or anything like that. It's just a release of gases within the joints as we restore motion to those joints. And one of the things that we want to keep in mind is that your central nervous system, your brain, your spinal cord, and the nerves that come out of the spinal cord are what control everything. It controls your respiratory system, your digestive system, your reproductive system. So every organ in your body is controlled by your nervous system, and it's protected by your spine and your skull. So, what chiropractors kind of focus on is restoring motion to get pressure off of your nervous system. It's not just about, cracking your bones and
Mm,
making you feel better. It's about eliminating pressure off of your nervous system so that your body's able to function the way it's designed to.
I think that's fascinating. I don't think, I mean, I've heard of it because I have a nephew in chiropractic school right now, and he had shared that. But I think that's probably going to surprise many people who hear that, that the quote unquote cracking that you hear is actually a gas released from the joint or that was pressured in there. That fascinates me. Um, you you emphasize treating like the mind, the body, and the spirit together, without sharing a name of an individual or whatever. Um, can you give us a bit of a story where you've seen this approach make all the difference in the world of one of your patients?
One patient comes to mind who had severe arthritis and was dealing with a lot of pain,
Mm,
and they were able to get to the point where they're completely pain free. So, restoring motion, getting pressure off of your nervous system can be pretty significant to some people. Um, you know, we don't think too much of like pinched nerves when we're thinking about chiropractic, unless you've had sciatica yourself and dealt with that. But there was a pathologist who studied over 200 cadavers, and he found that whenever there was a pinched nerve, there was organ damage. So we don't think about this because we're maybe not experiencing any pain, but when you have a pinched nerve, it's going to lead to organ damage somewhere in your body. So it's something to consider integrating, because again, your nervous system controls everything. And there's no way to get that pressure off unless you're integrating some type of manual treatment.
Hmm.
There's no pill that can realign your spine or get pressure off of your nerves.
I think many people that will be listening to this that follow me, uh, I would imagine many of them deal with pain on a daily basis. I know I use work as an escape from pain, um, along with, unfortunately, it got from me narcotic based, and I would give anything to be able to leave the side effects of that aside. In a world that, you know, often jumps straight to medication or surgery, how do you help patients see the possibility of naturally healing their body as opposed to taking pain relievers to band aid the solution?
Yeah, so it's kind of like our Western model to think that there's a pill for everything, or surgery, and those things are important and necessary sometimes, but it's not the answer to everything, right? There was a study that found that over 100,000 people deal with consequences from taking over the counter and prescription medication, like ulcers and digestive issues. And there was over 16,000 deaths every year. So, when you're taking this stuff over time, it can really cause damage to your digestive system and lead to serious side effects. So sometimes we're experiencing a lot of pain. You need to take something by all means, but it should be a temporary thing where you're seeking a better solution to your problem.
Well, that hits close to home for me because my wife and I have talked about that often. I knew pain was part of my life story since I broke my neck. Um, but as I've aged into my mid 40s, um, that's when it got noisy, too noisy, where I couldn't properly, as a pastor, counsel, preach, or whatever. It just took over my mind. And so, um, yeah, I'd love to know your thoughts even now or after the show. Is there a way to get um, most patients, would you say, treated, if it's holistically, body, mind, and soul, to a point where pain can be managed 90% of the time, or even whether 75% of the time would be great? Is that a realistic view for anyone dealing with pain? Not that we would say to anyone, run out and do this. We would say consult your own doctor first. But what are your insights on that?
Yeah, absolutely. I've yet to meet a patient that doesn't benefit from chiropractic care.
Wow.
Um, you know, it- there's there's some patients who go from 10 out of 10 to a 0 out of 10 in terms of pain, and there are patients who just decrease the pain, depending on what's going on. So there's a lot of benefit to integrating these type of benign treatments that don't have any major side effects, like chiropractic and acupuncture, massage, physical therapy. Those things are things that everybody should be looking to integrate if they're dealing with some type of pain.
Hmm.
One of those, some of those are all of those.
When you briefly mentioned traveling abroad, or also the westernized take a pill for everything, do you see uh, different results in differing parts of the world, less medical clinics or things like that, where all of a sudden, for the first time, people have some sort of relief, even when they don't have medication or things like that, as compared to the Western world? Because you're right, so often there's so many choices of over the counter and then prescribed things. But I'm just curious whether, like, when you look at a globe, um, have you noticed that different places, different results?
Yeah, it does vary, because also our nutrition is very
Hmm.
modified here. Even you look at even Europe and other countries that aren't so far away have better nutrition, and better foods available. So a lot of that plays a role. I think everything seems to be about money in this country, but there is a difference, and we do have information. We do have a lot of treatment options. So, um, you know, speaking to your medical doctor, speaking to a chiropractor, speaking to your acupuncturist, your PT, your nutritionist, your holistic doctors is a really good idea, and they're available to us. So, looking to other forms of treatment is a good idea.
For those of you that are listening, I'm excited in the next couple weeks to be having on the podcast a nutritionist that's well known in the US. And she's, in our pre interview, talked quite adamantly about how our diet affects our whole body. And so I'm interested to see how these kind of dovetail together with you talking about, the same things, nutrition, but adding onto that some of these holistic methods and definitely addressing the soul and the mind as well. For listeners, maybe who've been dealing with chronic pain right now for a majority of their life or since their accident or illness, what are maybe 3 simple lifestyle changes that they could start today that may bring some relief to their pain situation?
Be mindful of your diet. So a lot of foods can be inflammatory in nature. Try to get enough sleep. Integrate movement. Exercise is very important. And when we talk about movement, a lot of times we think of just exercise, but movement of the spine is also important, right? So you
Mhm.
have each vertebrae in your spine has its joints, right? So each one of those vertebrae should be moving individually. And sometimes we have trauma, we have micro trauma that adds up over the years, and we have limited movement there. And then that again could lead to pinched nerves or increased pressure on the disc and pain. So, getting evaluated to see how your joints are moving in your spine can be, a big difference in how you feel and how you respond, and your ability to have more energy and exercise and sleep better. All those things kind of tie in together.
Yeah, that's great advice. Great advice. Let's change gears a little bit. You're the father of, I think, 3, a power lifter, and certainly a faith-driven entrepreneur with your business there. How do you balance those roles um, without burnout? Uh, Burnout happens so quickly and easily. Um, what's your what's your answer to that, and what do you do to try and have a balanced life?
I think it's important for me personally to stay connected to the word, to read
Mm,
it, to listen to it. And I think everything else flows from there, being a good father, and being a good boss at work where I, manage a big team of, other doctors and staff. So everything kind of falls into place after that. So I think it's important to, have a balance where you're not overdoing it in any one area.
mhm.
And I'm blessed to the point where I can spend less time at work because I have a good team, because um, everything is moving the way it's supposed to.
Yeah, that's phenomenal. The Word of God, um, never outdated, uh, best-selling book ever, and will remain that way for a reason. God has a desire to speak with all of us, and we at SwagAbility believe that with all our heart. Has there ever been a time, adversity, whether it be inside or outside the clinic, personal, financial, or spiritual, that has brought you to a point of wanting to quit? And if so, second, um, how did you push through that?
Yeah, I mean, I personally was dealing with renal failure, and I got to the point where I needed a new kidney. And there was some fear, and there was a lot going on in terms of what does the future hold for me. What is life going to look like?
Mm,
But leaning again on the word and just kind of sometimes coaching myself out of that state was pretty significant. And I was able to see, God provide, and again, bless me with a good team and a good system where we can, thrive as a business, even in my absence, and my healing process.
Thrive is a word that we've come to love at SwagAbility. Our whole tagline is "Thrive where life finds you." So I think that's great. If you don't mind me asking for myself and our viewers, did it require a transplant of a kidney, or were they able to fix the if renal kidney, I believe, isn't it? Um, and how is your health now as a result?
Yeah, so I did get a kidney transplant from one of my sisters, which was a huge blessing. Uh,
Wow.
and I'm in pretty good shape right now. I my energy is not 100%, but just about. I still work out. I get back to lifting. I can't power lift just quite yet, but I'm lifting and I'm doing the things that I love to do, thanks to that blessing.
How many years ago was your did you receive the kidney, and how long does a transplant normally take to recover from? I guess it differs per person, but what a doctor's expectation would be.
So I actually just received it 4 months ago, so it's actually fairly new.
Wow.
And I'm doing pretty good. It took a little bit to kind of get to the point where I felt like I could get back to exercise and normal activities. Um, but when it comes to kidney transplant, there's a huge need. So if anybody's ever thought about donating, it would be life changing for somebody else. You can live perfectly fine with just one kidney.
Mhm.
When it comes to those transplants, the recipients of a live donor on average will have a kidney for 20 years. And when it comes from a deceased patient, the average of that kidney is about 10 years. But that varies. I know people who've had their transplant for 30 years. My mom herself received a kidney, has had it for almost 30 years. So it can be a huge blessing to somebody else.
Uh, yeah, life altering to allow life to continue, and 20 years for a kidney from a live donor as opposed to half on average statistically from someone that's come from organ donation after a death. I did not know that. My dad, he had leukemia and received a bone marrow transplant, and I remember him going through something called graft versus host. I'm just curious from a medical perspective, and just because that's how my brain works. When you receive a kidney, is there certain things that must match? Uh, and if so, or if not, does a body go through something similar, graft versus host, uh, when it's a kidney?
Yeah, there does have to be a match,
Mhm.
but there are a lot of programs in kidney transplants where, let's say, you want to donate to your spouse, but you're not a match. You can um, get into like the swap program where you're like donating to somebody else who's donating to your spouse. So there's a lot of opportunity to donate out to people that you want to help, but it does have to match in terms of blood type and antibodies and other things that they consider.
And where does someone go? Again, we're not out saying harvest organs. That's never what we would say here, and I don't think for sure the doctor's not for that. But where would someone go that is looking to offer hope or life? And where does someone turn that would say, I would be okay to step up in line and offer part of my life, part of my body to the medical world to help someone live? Um, is there a transplant number or a website, or is it you start with your family doctor? I'd have no idea where to look.
Yeah, I'm sure there is. I'm not familiar with them, but a lot of the local
Right.
hospitals do offer this service where they do transplants. I know in my area, well, I'm near New York City, so just about every hospital
Yeah.
offers this. So, it's one way to get in touch. But a lot of times you'll know somebody who's either on dialysis or dealing with this type of stuff, and you've never considered it. And maybe, this is God telling you to consider it.
Mm, amen to that. We drove through your area maybe a week and a half ago, Yonkers, New York. We had stayed there and did some mission work down in Hunts Point, Harlem area, but we stayed outside the city at a good friend's house there in Yonkers. So I know the place well, but it would have been neat to know you were there to stop in and say hello. But
Yeah, absolutely.
congratu- congratulations on having a top business in that area.
Thank you.
Um,
Thank you.
the healthcare system, whether it's in Canada or maybe even more so in the US, can kind of be cutthroat. How do you keep your work mission driven as opposed to profit driven? Is it back to the word
Yeah,
or
it comes down to my beliefs.
yeah,
Everything I feel like that I've been given is a gift from God. So, giving back is part of receiving for me. So,
amen.
um, yeah, it goes down to my core beliefs.
Hmm. I mentioned earlier I have a nephew in chiropractic school in Toronto right now. If you could teach every new chiropractor one lesson about combining skill, compassion, and purpose, or any of those, um, what would it be? Think of any come to mind?
Yeah, I would say, consider every patient like a family member, like your mom or your kid, and offer the very best care that you can. Take your time, listen, and do the very best that you can. If you take that approach and you really care about your patients, you're going to have success and you're going to be able to help a lot of people.
Yeah. Uh, friends, SwagAbility is more than just a cool brand name. It's a movement. Our sole desire is to help you thrive wherever life finds you, whether you're living with a disability or caregiving for someone you love, or simply seeking encouragement. SwagAbility is here to remind you that you're not alone. Explore our resources and stories and support us at swagability.com. And be sure to check out our SwagAbility Show in the notes and subscribe to our YouTube channel. It would mean the world to my wife and I. So not only subscribe and like, but share it with someone who you think it could really help and who we could be a help with. Because our whole goal, as we've said, is helping people thrive where life finds you. Um, let's wrap up with a few questions more, and then I have a little bit of fun with some questions at the end. If you could sit across right now from your younger self, um, uh, the one who was battling pain before finding this whole chiropractic avenue in life you've taken, uh, what would you say to that self?
Don't worry, everything's going to work out. I
Worry.
think sometimes we kind of get too caught up in the stuff that's happening, and we forget that the God that created us and the God that we serve is in the future and he's ahead of us, and things work out. Things work out.
Amen to that. I remember one of my biggest worries was that I was going to miss the will of God. And I remember as a teenager, like, how do you know what's the will? How do you know what's the will? And I remember my grandfather saying, get up today and do what is right. Make choices that you know are right. Take care of the wrongs that you know you've done at the end of the day. And tomorrow, if you're still here, do it all over again. You will be in the will of God and find it. And I thought that was the best advice I'd ever been given. Do what's right today. And if tomorrow gets here, get up and do it again. And in the process of that, making decisions, uh, you will find yourself, I believe, uh, in the plan God's designed for your life. You're not just here to roam for, I don't know, 70 and 10 years. Um, there is the ability to have purpose and thrive in life. So thank you for that. What's the most surprising or maybe inspiring transformation you've ever witnessed in your practice? Thinking back over 21 years, you think of something that's come to mind that was truly transformative or inspired you from either one of your patients or either maybe as a doctor, that something that was taught to you?
Yeah, I mean, I was able to see other doctors actually having, you know, these miracle results, where patients who couldn't see were able to regain their vision after chiropractic care. And personally, myself, I was able to treat patients who weren't able to get pregnant and then were able to get pregnant after chiropractic care. So we see a lot of these little miracles because, you know, your nervous system controls everything, and getting that pressure off can allow your body to function the way it was designed to. So, you know, we see those often. It's not something that we can go around saying, "Hey, we cure this and we cure that." But when your body's able to get that pressure off, you know, God created it in a way where it can function amazingly.
Yeah, I, I think I hadn't thought about that until speaking with you today. That you're saying like pinched nerves and things like that. I guess in our perfect bodies, everything worked well, but after the fall, um, something as simple as a pinched nerve um, has a trickle down effect in the body, and I, that was that was kind of a brilliant moment that just helped me realize that it's taking care of everything that you notice. It's not letting something linger and toughing it out. It's not being a worrywart about everything, but making smart decisions to address issues that you feel when you are having problems. I know the piece of advice you would say to your younger self was don't worry. But similar along those lines, if you had to give one of our listeners one bold, unforgettable piece of advice about healing and living with purpose, um, Dr. Alex, what would that be?
I would say, you know, to if you haven't found the thing that works for you, you know, keep looking. You know, keep looking because it's out there. You know,
Mm,
again, you know, there's a number of things that we don't think about when we're sick, but you know, from nutrition to sleep to creating balance in your life to managing stress
mm,
to leaning on the Word of God to, you know, integrating, you know, other treatments that you haven't done in the past, can be life changing.
mm. Yeah, I think so often I know I'm guilty of just settling, like thinking we've exhausted everything and just settling for maybe we'll just mask the pain some more, but uh, to not look at alleviating it. And so you've really encouraged me today to take a look at not just masking pain, but trying to figure out how to alleviate it and um, to treat my body for longevity. Because I do want, as long as God's given me, I do want to be here in a healthy way to continue doing what I do. And so thank you for opening my eyes to that
Correct.
today. Before I let you go, um, one word, all right? One word that defines each of the meanings to these things, okay?
Okay.
Uh, let's start with, sure, faith. One word that defines what faith um, means to you,
Trust.
okay? Family.
Most important.
We'll put a hyphen in there. We'll call it one word. I like that. Absolutely most important. Um, Fitness,
Essential.
essential. Okay. Uh, Chiropractic.
I want to say life changing, but that's too rare.
We'll put another hyphen in. It's fine. We'll put another hyphen in. That's great. You've been a great guest. I've really enjoyed this and you've given me so much to think about. And I'm sure those that are going to listen after. Thanks so much for sharing your journey and insight with us. I found it super powerful. Friends, if you want to learn more about Dr. Halario's work, visit his website at
Chiro Rehab Source. Yep.
chirorehabsource.com. It'll be in the show notes. And while you're there, don't forget to help us grow this community at SwagAbility. Subscribe to our YouTube channel at SwagAbility Inc. and visit our website at swagability.com and stop by to see how we can support you better. At SwagAbility, again, our sole desire is to help you thrive wherever life finds you. Thanks for listening. We'll see you the next time. And remember, friends, stay safe, stay healthy, stay strong, and thrive wherever life finds you. Until next time, Swags out.